Good evening, everyone in Lukman Nation. Hey. Welcome to another episode of the Black Labor Bulletin in Lukman Nation. Thank you so much for joining us. If you're watching on Black Power Media, you are watching on the most dangerous platform on social media, and you're watching Lukman Nation, the most dangerous show on social media. And I really appreciate you joining me tonight. It's not a typical night because, there's been a lot going on with me. So my schedule was kind of thrown off a little bit, but we're getting back to our regularly scheduled programming. And now that I'm a part of the lumpen proletariat, as it were, there might be some additional programming that I might throw in there because, now I got the time. So, to start the show off, for those of you who do not know, our Sean Blackman and myself, who were the host and the co-host of By Any Means Necessary on Radio Sputnik, our show was canceled. By Any Means Necessary is no longer on Radio Sputnik. Sean Blackman and I we are no longer employees of Radio Sputnik. And we talked about that on the Remix Morning Show yesterday and today. The official joint statement from Sean and myself is posted on the By Any Means Necessary Twitter page and on the By Any Means Necessary Facebook page. And for legal reasons, that's all I can say. But trust, your girl gonna be fine. So anyway, let's talk about some Black labor, shall we? Because this particular fight has been brewing for some time. If you recall, last year, I think it was the first time we talked about the struggle of Maximus workers to organize for their rights. And if you don't remember, Maximus is a call center company. And actually, I think it's the sole contractor for the Center for Medicaid Services, for Medicaid, Medicare, and I think it's the sole contractor for the Affordable Care Act. But my two guests, if I am incorrect on that, they will correct me. So I'm very happy to be joined tonight. What did I just do? Clicking things and Kiara Mark, a former Maximus employee. Welcome, Kiara.
Hi, I'm happy to be here.
Oh,
can you hear me now? Okay.
Yes, can hear you now. Fantastic. And we are joined by Tanya Jackson, Tier 2 Medicare CSR Customer Service Representative. For those of you who don't know, Tanya, thanks so much for joining me.
Thank you. Thank you for having me.
Oh, Tanya, are you frozen?
Okay,
there we go.
Okay. Thank you all for having me today. Can you hear me okay?
No, okay. Sound and video, we're popping. We're cooking.
Okay.
All right. So, Kiara, how long has this fight been going on for Maximus workers against the company? How long has this effort to organize been going on?
Yes. So we have been organizing this call center since 2017. It's been 8 years now. 6 years, sorry.
Mm-hmm. And what kicked this off? What were the employees? Why did they start to organize at the Maximus company?
Yes. So Maximus Federal is a call center that handles calls for things like Medicare, Marketplace, and even the CDC. And the work we do is essential federal work, but we don't get paid like essential federal workers. Maximus continues to pay us the bare minimum, and we're getting paid thousands of dollars less than what people who do the same work that we do, who are federal workers, are getting paid. There are unforgiving policies within the call center with regards to bathroom breaks and things like that. And there's just different types of union busting tactics and everything that goes on within the call center.
So, Tanya, for the workers, Maximus workers are contract workers. Is that correct? They are not,
right.
That's
correct.
Kiera said, they're not federal employees. Although, is it true that they're the company that handles all of the calls for the Affordable Care Act and for Medicare?
Yes, it is. I've been with Maximus. Well, we started off, like I say, 2017. I started working in 2016. So what kicked it off? I think the site opened. This is actually in our site, our 10-year anniversary for opening. So when we first started, we were only making $9.05. So there's people that were there since 2013. I came in 2016 making the same thing as they were making. And people were wondering, why can't we get a raise? Every time they ask site managers, everybody for a raise, well, it's going to take an act of Congress. So workers got fed up. They heard about CWA and, how they help organize. So once we got in contact and CWA started to look into the practices of, we were GDIT at the time, and found that it was not some good, so good practices. And all of a sudden, like a year later, lo and behold, we got a small raise, which, is going to take an act of Congress. I mean, if we wouldn't start organizing, pushing for better, we would still more than likely be at $9.05 this day and age. It's like that. Yeah, they were not trying to give us anything.
Did you say $9.05?
$9.05. Yes, ma'am.
Wow. So let me clear up a couple things for folks who don't know what the acronyms mean. What is the CSA? Tanya, sorry.
Okay, CSA is I got a brain freeze. Kiara, can you help me out a little bit with CSA?
No worries, I get them all.
Okay.
Yeah.
STA, I'm sorry.
Yes. Did you mean CSR? When Tanya says she's a CSR?
No, the union that you all are organizing with.
Oh, yes.
Oh,
that's
CWA.
Yes.
Okay.
So CWA, yeah, that's the Communication Workers
See,
of America.
I get brain freezes too.
Yes, that's Communication Workers of America.
There are too many acronyms, because the other acronym that really tripped me up was, Tanya, you said that Maximus used to be GDIT.
General Dynamics.
Was that correct?
Yes, it stands for
So I know that acronym.
Okay.
Yeah, I know that acronym because GDIT is General Dynamics IT Services. And when I was a contractor for the Securities and Exchange Commission, guess who bought the company I used to work for? GDIT.
GDIT.
So, and for people who do not know, General Dynamics is General Dynamics is an enormous defense contractor. It is one of the, if not the largest. I think it might be second in maybe size and revenue to maybe Raytheon or Lockheed Martin or something like that. But General Dynamics is an enormous defense contractor. And they also have some civilian contracts, but I'm here to tell you, those contracts are not as big or as lucrative, and they do not make the company as much money as the defense contracts. But a contract like this one, so this is why companies like Maximus, they may be sort of acquired at some point by General Dynamics, but then they get tired of, and I'm not saying this is what happened with Maximus, but sometimes this does happen when a smaller company is acquired by a behemoth like General Dynamics. And then that smaller company realizes, wait a minute, these people are taking all of our profit. And so they will kind of break off and then create another smaller company. So it's very, very, very interesting dynamics in the in the government contracting world. So Kiera, the employees of Maximus provide the literally answer the phones for people who are signing up for the Affordable Care Act and for Medicare. And this is everybody in the country who needs those services. So the employees who are answering the phones, on top of only making to start like $9 an hour, that's just obscene. What are the benefits like for call center employees who are providing this vital service for the government? What are the benefits packages like for call center employees, Kiera?
Well, another issue within our call center is the fact that while we're helping millions of Americans access affordable health care, many of our workers are on that same government assistance because our health benefits are so poor, actually. While people were making $9 an hour, our health care was actually $4,500. That was our deductible with the health care that Maximus was providing for its workers. Through organizing over the years, we've actually just won getting our healthcare deductible lowered to $1,800 now, which is still substantially high, but it's less than what it was at first. But yes, we do have healthcare, even though many would say that we don't because it takes so long to get out of that deductible. We do have sick pay, but it's only, I think, like an hour or 3 hours for every 40 hours worked, which was very hard on workers when COVID-19 was happening and people couldn't take off time from work to care for themselves after being exposed in the call center. And yeah, benefits, we have them, but we think that it's not really beneficial to the workers.
None. It's not.
Wait, did you just say people couldn't get?
Yeah. Mm-hmm. Go ahead.
Go ahead, Tanya.
Yeah, we actually had a coworker that needed an emergency pacemaker put in, and they actually denied it. Said it wasn't medically necessary. Another coworker just last month needed cataract surgery, and they said, "Well, no, you can see with glasses, so we're denying your cataract surgery." So the insurance is not good insurance. You have to jump through hoops to get, a lot of services that people is medically necessary, we're not able to get.
So you mean to tell me there are people working, answering the phones, helping people sign up for Medicare and the Affordable Care Act who literally need a pacemaker to keep them alive, and Maximus denies their ability to do that? So do they just like literally expect y'all to work until you like literally drop dead?
Sometimes it feels like it.
Yeah, it feels like it sometimes.
Yes, honestly. And if workers do pass, there's no remorse for their families. Maximus just replaces them. There are people who said that they lost relatives that worked at the call center, and it wasn't until us, the workers together, who are organizing the call center, actually were like, "Hey, we're sorry for your loss," or anything, spoke to them, and they felt like they actually were saw as a human being because Maximus treats their workers like numbers.
Man, I was not expecting the pacemaker. That threw me for. I mean, that's another level hardness. heartless.
Oh yeah.
That's heartless. That's corporate heartlessness on a whole nother level. And I should have asked when we began, but now I think about it. Where in the country are these call centers mostly? Like, Kiara, where are you? And Tanya, where are you?
I'm in Hattiesburg, Mississippi.
Yeah. And I'm remote. I work at home out of Hattiesburg, Mississippi. And basically, most of the sites are in at-will states. You look at it, most of them are southern poverty states. You have Mississippi, Texas, and it's like lower Texas, El Paso, Brownsville, hey, not doing any much. Louisiana, Florida, Kentucky, Virginia. I think they open up a couple somewhere else, but most of the states are like at-will states.
Wow. And I think, I'm in Washington, D.C., and people think of Northern Virginia as like a part of Washington, D.C., but people don't quite understand that Richmond and south of Richmond is actual rural Virginia, and it's a whole, and all of Virginia is an at-will state. So they can pay you what they want. If it's $1 above the federal minimum wage, that's what you get.
Right.
and they can fire you when they feel like it, and not whatever. So wow, that is amazing. So what has Tanya, the organizing effort with CWA been like? How did it start? What was the response from Maximus to the workers trying to organize?
Well, of course, their response was, "Oh, unions are bad. They're going to take your money. You're going to be paying $25. Well, say a half-hour check. Basically, the union is going to get." So they have all these. If you sign this, you're joining a union. You can come talk to us. We have an open door policy, which they don't.
You can. Did they tell you that we're all family here too?
Oh yeah. Oh yes, we are family. Just none of it's true. You can be out the door in the blink of an eye, and they won't. On to the next person. So not a quite. I guess it's an extended family. Yeah.
Right. And organizing is so hard within the call center because Maximus does do a lot of union busting tactics, not only with the anti-union trainings that they have, but several times they've called the police on us.
Oh, yeah.
Just recently, I think it was like September, they called the police officers on us while we were out flyering to our coworkers and telling them about the upcoming strike. There have been times we were organizing in different states and we were talking to people in the parking lot, inviting them to a meet and greet, and they called the cops on us. Several people were wrongfully terminated, or in most cases, if there's someone who's active in our organizing committee, they either try to give them a promotion so that they aren't able to be represented by the union.
Yeah.
Or they send them home.
They love to give promotions.
Wow.
Yeah, they send them home when they
Wow.
never were allowing us to work from home before, or they lay them off, like my case. So yeah, lots of union busting that makes it pretty hard to organize the call center, especially with the 40% turnover rate that we have.
Right. And then whenever they do, it's like you get a lot of people that, because we used to have like one of the biggest sites, and now we're like, at any given time in the past, we could have up to like 2,000 people. But now we're like down to, I think it's under 600 now.
Yeah, about 6.
And that's, yeah, they've really, really brought it down a lot.
So Tanya, somebody asked in the chat, and I think this is a good question because sometimes I forget that not everybody understands what all these terms mean. What does it mean if a state is an at-will state?
That means they have the right to fire you without cause. Just say, they can wake up in the morning and say, you know what, we're going to let you go. It's not like they have to give you an explanation or anything. They basically do what they want to do.
Mm-hmm. And you don't have any right to
any rights.
Nothing, no arbitration, no nothing.
Right. And then people try to go and get unemployment, which in Mississippi, unemployment is one of the lowest. And they deny some workers from even getting their unemployment.
Wow.
Yeah.
Wow. Which is all perfectly legal. All perfectly
it's
legal
legal
for the company to impoverish people to, yeah.
Right.
So Kiara, you mentioned the word, which is one of my favorite words, strike. What is going on in regard to hopefully the potential for Maximus workers to strike? And what if that happens? What would that mean for this country's ability to, participate in open enrollment, get their insurance plans together? What would that mean?
Yes. So we are one of the biggest federal contractors. Like I said before, our services are essential. The last time we went on strike, during open enrollment, it was about 500, 600 workers that were off the phones. They were saying sometimes either the wait times would be long while we were out on the strike lines, or managers had to pick up the phones. So if we strike and we go even bigger this time, because now we have not only just Louisiana and Hattiesburg, Mississippi on the strike lines, but 6 sites, maybe even 7 sites on strike. This could probably mean that some people, it would be hard for them to access that affordable health care for them during open enrollment period. And we don't want to have to stop that process for people, because we know that it means a lot for folks. But at the same time, that's the only way that we can show Maximus how important we are, when they treat us as if we're disposable.
Exactly.
And so, Tanya, what are you all asking for in this potential strike? What if Maximus responded to the workers' demands to avoid the strike? What is it that Maximus would have to do to do that, to avoid this strike?
Okay. So what we're asking for on this strike, we're asking for demands such as $25 an hour. It's not a lot. Basically, it may seem like a lot to people, but it's not. Our counterparts that's directly with the government, Social Security, IRS, they all make it. What we do at Maximus, especially with Medicare, we basically take some of those calls because we get referred by those entities, and they tell them to contact Medicare for a lot of things. So we're basically taking a lot of phone calls that these other entities that's making more money than we are, they're supposed to be doing. We're asking for, we don't get all the holidays off. They're able to get all of the holidays, federal holidays off. Well, we have working holidays. We only get 5 holidays of all the federal holidays. We only get 5 of them off. And we're also asking for, respect. We're also asking just to be treated like somebody. We take calls from abusive language, racial slurs, and it's hard because the calls are back to back to back.
Wow.
And you don't get a break sometimes. Sometimes the calls are so back to back on top of each other, you can be on a phone call and it hangs up. And we're looking, time for at least, mental breaks during throughout the day. Bathroom. You only have 6 minutes the whole entire day for a bathroom break. And we're asking for
6
better
minutes?
bathroom. 6 minutes. And you better not go over.
For an 8-hour shift?
For an 8-hour shift. And some people work 10-hour shifts.
Oh my. And
Where
all of
there's
this is going
predominantly
on
women.
while that was going to be my next question. What are the demographics of the call center?
Yeah, so our last well, one of our last strikes recently, we've had so many over the last 12 months, but one of our recent strikes, we actually had a racial disparity report come out, and there's actually half of Maximus, more than half of Maximus's frontline workforce are Black and Latina women, but we only make up, I think, 11% of the top executives of the company that decide things like our bathroom policies, and our pay, and things, our family leave, when many of us are mothers, grandmothers, caregivers. But yeah, we're predominantly Black and Latino women in the South that are handling these calls. And that's why it's so essential that we do have things like, we recently won better protections against abusive callers, because we're handling all
Yeah.
these calls on behalf of the government, and they're saying things that are like racist, sexist, just downright nasty things to us. And for so long, Maximus had no protections for us. They would let us just have these people talk to us crazy. We had to tell them 3 warnings before we could hang up. And then sometimes, even then, people would get fired for
Getting
hanging
fired
up
for hanging up.
prematurely. So yeah. But now, since we won things like that abusive call protection, lowering our healthcare deductibles, we still want affordable healthcare deductibles so that people don't have to rely on things like government assistance. And we want to have that $25 an hour and a right to unionize. And like people are saying in the comment section, we just feel like that's the basics, right? That's the least that they can do if we're making them billions of dollars during open enrollment period.
Mm-hmm. Wow, that is so, just it is shocking and amazing that this kind of worker abuse is going on, not just in this country, but particularly in the South, in certain states, providing a vital service that every single person in this country at some point has to engage with. That the very people that we call to help us get some type of health insurance coverage, even if it's, the ACA, which is certainly not the best there is. But the people who are providing that service can't even get decent health insurance for themselves. And they are providing the service, you all are providing the service for the federal government.
Right.
Insane. It's just insane. So, how can we support you all? What can we do? I know somebody in the chat said that they did a search for Maximus GDIT strike, but I just had to remind them Maximus is not a part of GDIT anymore. It's a standalone company. But you probably won't find anything about the strike because, look, we understand how the social media and the tech agencies are in collusion with the capitalist corporations and the government to suppress all kinds of information about worker struggles. So there's that. But how can people support you all? What can we do to bring um, uh, uh, attention to this issue? How can we be in solidarity with you all while we still need these services, but we don't want to continue to prop up an exploitative system where the people who are providing the services to us are being treated like garbage? So either one of you.
Yeah. So we do have a solidarity fund that people can donate to. We use this solidarity fund because Maximus, again, with their union busting, they try all the time to keep people off the picket lines. So with this community solidarity fund, people can donate to make sure that workers have the money that they need to afford things like their medication, their bills, and their groceries when they're missing that day off from work on the strike lines. Like you said, there is a lot of censoring things like this with these billion-dollar companies. We are on all forms of social media at Call Center Workers United. And you can find us on Facebook and on Instagram and on Twitter at CCW United. And you can find some information there about all of our past strikes, as well as some links to our Solidarity Fund. And if you just share all that content, that would be amazing as well.
Right.
We want to have as many
Sharing.
eyes as we can on this campaign, as many community supporters as we can, because that means a lot to us. And yeah.
Ladies, thank you so much for joining me tonight. I really appreciate you continuing this struggle and standing up to a behemoth. I don't think people who have never done government contracting understand how powerful these companies that get these government contracts are, especially when they are the sole source contractor for a massive
Right.
government contract. There are supposed to be, and I know this because I did government contracting for so long. In the government contract, there's supposed to be standards for how the people who work on the contract are supposed to be paid, the kind of benefits they're supposed to get, all that kind of stuff. All of that stuff is supposed to be negotiated in the contract, literally in the price of the contract. So what the government pays the contracting company is supposed to include everyone's salaries, the cost of everyone's benefits, the cost of everyone's leave, all of that. But what happens is these companies will low bid each other. And the very first thing they cut out are employee salaries. They will cut employee salaries. They will overpromise the government and underpay the people who work on the contract, or the people that they will hire to work on the contract. So they'll tell the government, okay, we don't have to pay people the prevailing wage in that state. We'll pay them 30% less in order for the contract negotiating bid to come in lower than the other guy. And then that's not enough, then not the benefits. And then if that's not enough, then they'll just cut the workforce that they say that they need to do the contract. I've seen this done over and over again. And these companies will get the money from the government for the contract, at least for the first year, because most federal government contracts have a base year and several option years. Three option years is the average. Some contracts are longer. Very few contracts are awarded from the government where they get the entire uh, uh, length of the contract, the entire 4 or 8 or 10 years of the contract. The government usually doesn't pay all of that money at once. They'll pay for the first year, right? To start the contract up, to hire the people, to build out the facilities and whatnot. So then every year, the agency, the company that won the contract, in most cases, have to prove that they have done the work and they've done it satisfactorily to the government's satisfaction. And this is where things get really, really interesting, because this is where those special relationships between the people and the government who decide who wins these contracts and the CEOs and the boards of directors of the companies that bid on the contracts. This is where those special little relationships that are supposed to be illegal, this is where it comes in, where contractors get away with the kinds of things that are being done by Maximus, and the federal government will continue to certify that contract and continue to pay the contractor, even though certain metrics may not be met. And if they're not met, then the contractors will sometimes cook the book and lie, saying that they're meeting the metrics. And the government may know this and they don't care, because they don't have to pay the next higher bidder more money to actually do the job right.
Right.
Um, the abuse of employees, substandard work environments, safety hazards. Contractors lie about that stuff all of the time in the annual, sometimes biannual, I forgot the word is recompete. That's what it is. In the recompete for the contract or the annual, it's called a past performance or performance metrics that the contractor has to submit to the government at every option year. Because what's supposed to happen is the government, after the base year, let's say the contract is 4 years, the government pays for that first year of the contract to get it started up. At the end of that first year, the contractor is supposed to prove that they've met the government's requirements satisfactorily. If they have not, if the contractor has not, the government has the option to opt out of the rest of that contract and recompete that contract and pay somebody else to do it.
Right.
But the government always runs the risk of having to pay more money than they paid originally, and they don't want to do that. So they know that these contractors are lying through their teeth about all kinds of things during these option years, including underpaying employees, denying benefits, outright straight abuse. And the things that I have seen go on in some of these contracting offices where you've got sexual harassment, you've got racial discrimination, you've got, denial of child care and all kinds of, and reports are made allegedly to the contracting officer. There's supposed to be a contracting officer who is supposed to be a representative of the government at the contract site. And those complaints usually go nowhere unless it's like hella egregious and gets a lot of national news attention. So, the only people who really benefit from the government contracting scheme are the government and the government contractors.
Mm-hmm.
Just like every
So
other
true.
capitalist entity in this country, the workers lose.
Suffer. Yeah.
Yes. Especially when HR, is working for those contractors as opposed to the employees. That's why we stress to our coworkers that it's so important to unionize so that we have a voice together in solidarity with one another against things like these. And we have addressed our government and things like that. And we actually have the backing of Senator Bernie Sanders. Recently, he wrote a letter to our CEO, Bruce Coswell, demanding questions to things like the union busting tactics that he had, why he's paying people $200 not to go on strike, and why is he laying people off 2 times this year when he's told the government that they're actually doing well and the government sent him so much money. And another thing, we do have workers that are trying to reach out to get the attention of the Secretary Becerra of Health and Human Services so that he can investigate Maximus. Because like you said, this is a big behemoth. We can only get so far on the ground. At some point in time, we do need our government to step into things like this.
Kiara Mark, Tanya Jackson, thank you so very much for joining us tonight and reminding us why we need to be in solidarity with all workers. All workers are essential. I don't care what they do. I don't care if they flip burgers, mop floors, dig dishes, or answer the phone so we can get some health care. All workers are essential. And you ladies absolutely are. Thank you so much.
You're more than welcome, and thank you for having us.
Yes, thank you so much.
You bet. We'll definitely looking forward to an update. Reach out to me and let me know what happens.
Okay, we most certainly will.
Yes, and also one thing before we leave.
All right.
Our strike is November 9th.
Yeah.
Our strike is November 9th for everyone.
Thank you.
If they're interested in joining us on the picket lines in all different places across the country, follow us on social media and you'll find some more updates there.
All right. Yes.
Fantastic. Thank you all so much, ladies. We appreciate you.
You're welcome.
All right, y'all. November 9th. That is the deadline. That is the strike deadline. November 8th. Maximus better come to the table and come correct. And if they don't, they get a picket. And that's fantastic. So let me see real quick if I can pull up the socials for our comrades, CCW United. Make sure I got that right. No, that's not what I said. Man, social media be blowing me. It just be doing wild stuff. Let's see. Let me try this. See. Nope, that's not what I want you to do. There we go. All right, so here is the Twitter. Come on now, get in there. There we go. There is the Twitter page for CCW United. Let me go over to Facebook and drop that for you. Although you are on the internet, see it, and you could do it yourself, but I'm gonna be nice. Let's see. A bunch of weird, kind of sketchy pages on Facebook. Let me see. Hold on. Let me look. Nope, that's not it. I will drop the Facebook page for you when I find the legit one. Hold on. Let me. A bunch of private groups, and I don't want to send private group. So I'll find the correct group for you on Facebook, and I'll drop it in the description of the video when it's done. Really appreciate you all joining tonight. And as usual, let me see. Hold on. Let me make sure I got this right. Let's try again. Nope. There it is. Okay. All right. This is the Facebook group. Thank you, Tanya, for dropping that in the chat for me before she left. Here's the Facebook group for you. And all right. Really appreciate you all hanging out with me tonight on this, one-off kind of, because we didn't do a show last Friday because of all of the things. And yeah, a lot to really think about during open enrollment season. So if on November 8th, Maximus does not come correct for the workers, when you call to sign up for the ACA or Medicare, you may be on hold for a very, very long time. And that would be great if that happened, if Maximus does not do right by their workers. So thanks so much, y'all, for joining me tonight. If you have time, please go on over to, let me make sure I get this information to you correctly. Let's see now. There is going to be a fantastic webinar happening in about 15 minutes. And let me see if I can pop this out for you so I can share it with you. It is, get on over here. There we go. The rights of indigenous and Afro-descendant peoples in Nicaragua's Caribbean coast. It is 4 sessions Tonight is the opening session at 7 p.m. Eastern time. So you got about 13 minutes to get on over here. The registration for this event is here. I'm going to drop that in the chat for you. And our own Ricky Ryan is participating, is a presenter in this webinar. So you do not want to miss this. This is at 7 o'clock tonight in about 13 minutes. So get your snack, get your drink, and hop on over there and show Ricky and our comrades over in Nicaragua some serious love. All right, y'all. Thank you so much for joining me tonight. As far as I know, I'm going to have a show tomorrow night. Blackonomically speaking with Dr. Linwood Towheed. But until then, and as always, be really good to yourselves and each other. Luta continua, the struggle continues. But if we continue to struggle, if we continue to fight, Victoria acerta, victory is certain. Peace.